Welcome back to the PMU Entrepreneur Bible, Chapter 5. If you've made it this far, make sure you hit the subscribe button and leave a comment because I'd love to know what you think of the book so far. Now, this is going to be a long chapter, but it's one of the most important chapters in all of permanent makeup, and that is going to be sanitization and sterilization. Now, sanitation and sterilization is one of the most important topics in the tattoo industry because it ensures the safety of not only ourselves, but our clients. This topic is even more important to me as a nurse that has transitioned to the cosmetic tattoo industry after over a decade of assisting in the operating room and preparing sterile tables as a labor and delivery nurse. Proper sanitation of tools, our space, our hands, and our client's skin are the foundations of any procedure. Sanitation and sterilization are not the same thing. A surface is sanitized when a bacteria has been killed using an EPA-approved chemical. If a surface has been disinfected, it means that the bacteria and viruses have been eliminated from the work surface. Sanitization and disinfection are terms that generally refer to when surfaces are clean. We clean the surfaces of our skin, on ourselves and our client by removing dirt and organic matter using substances like soap or antiseptic washes like isopropyl alcohol. We do not use the same type of cleansers that we would use on a surface on our skin. Hand sanitizer can be used on unsoiled hands to kill pathogens on skin, but should not be used to remove visible grime in the place of hand washing. Sterilization refers to any process that removes, kills, or deactivates all forms of life and any other biological agents present on a specified surface, object, or fluid. Sterilization is achieved through heat, chemicals, irradiation, high pressure, and filtration. Most methods of sterilizing equipment used for permanent makeup tools will be steam, dry heat, or ethylene oxide sterilization, commonly referred to as EO gas. Any tools that are reusable and shared between clients and are on the client's procedure tray or handled when the client's skin barrier has been broken must go into an autoclave. Otherwise, it is not safe to use on the next client unless that object has been sterilized for the proper length of time at the correct temperature. Any reusable or disposable single-use item that has come in contact with the client's broken skin or placed on a surface that comes in contact with the client's broken skin or body fluid should be immediately disposed of to prevent any concern of cross-contamination between yourself and future clients if the item cannot be sterilized. It's impossible to sterilize the surface of the skin as it involves high heat or chemicals that would result in skin damage. If the client arrives with excessive makeup or a breakout in the area you're preparing to tattoo, it is appropriate to ask the client to fully cleanse their face prior to the procedure or have a small bottle of Hibiclens chlorhexidine cleanser to remove any potential pathogens from the skin surface. Hibiclens is a skin cleanser that is used in the surgical setting to decrease the amount of germs living on a surface of the skin that may be able to enter the deeper layers once the skin is opened during the procedure. If the client is experiencing a breakout or appears to have a rash or suspected infection around the area you're preparing to tattoo, cleansing the area will not help decrease the amount of bacteria on the skin if those blemished areas are open and releasing bacteria during the treatment. The concentration of bacteria released from the zit or potentially infected rash area will spread from your tattooed area, making the issue much worse for the client during the healing process, possibly requiring antibiotics that negatively affect ink retention. Properly applying personal protective equipment or PPE will ensure that you and your clients remain safe throughout the tattoo procedure. I always begin by setting up a sterile workstation for the client and setting up a clean workstation for my mapping tools. I always begin by thoroughly washing my hands with liquid soap and drying my hands with a disposable paper towel, never a cloth towel that may spread cross-contamination by allowing bacteria and viruses to be collected and redistributed onto the skin with each use. Also, make it a habit to wash your hands thoroughly before and after you remove your gloves, because no manufacturer can ensure that there are not micro tears and nicks that may interrupt the integrity of the protective barrier. Always apply gloves to clean hands after applying your face mask if you choose to wear one. For procedures in close proximity to the client's face, you do not want to put your mask on after your gloves have been applied, as you may touch your jewelry, hair, or clothes while adjusting your mask in place. While wearing a hair cover is not necessary for you or your client, many artists will wear one, and if so, again, you should apply it before you put on your gloves. When sliding your gloves over clean hands, be sure to only touch the wrist of the glove to prevent any spread of viruses and bacteria onto the fingers of the glove, where you will be touching the client's skin. It's not necessary to use disposable nitrile gloves while mapping the client's skin, as long as your hands are clean and the client's skin has been cleaned for at least 10 seconds. However, if you are concerned about any cross-contamination and you do find yourself touching unnecessary items during the treatment, make sure to use gloves, but understand that the gloves can also become contaminated as part of that process. Cleanse the skin thoroughly with 70% isopropyl alcohol until there is no visible makeup or dirt on the skin. Once you begin the tattoo process with the skin open, you should only touch the skin with gloved hands. You must remove your gloves by pinching the wrist of the glove on the first hand and pull the glove down your hand as it flips inside out, with the side that has touched the client's skin now protected inside the rolled glove. Holding the balled up glove with your remaining gloved hand, slide a finger down the inside of the glove where it is touching your skin. Pull the glove down so it now rolls with both of the gloves inside, so that they are again flipped inside out, so that the part that has touched your client's skin on the glove is now inside out and will not touch your skin. Always dispose of rolled gloves in the approved receptacle. Some states will require all material that touches the client's blood or body fluid be disposed of in a red approved biohazard bag, while other states allow this material to be disposed of in the regular trash. Once your gloves have been removed and safely disposed of in a plastic-lined container that meets the guidelines of your specific region, you will wash your hands for a minimum of 30 seconds using warm water and liquid soap. Hand hygiene is quite possibly the most important factor that will keep both you and your client safe from transferring potential infection to the newly tattooed area. Never perform hand hygiene or apply hand sanitizer while wearing disposable gloves. This may damage the integrity of the gloved surface and is unnecessary if you are properly washing and ungloving and re-washing your hands during the procedure. Artists in most European countries will also cover the client and themselves in protective disposable gowns and shoe covers. This is also a requirement when competing in competitive permanent makeup champions such as WULUP, or the World Universal League of Permanent Makeup. While the gown may be effective at protecting you and the client against any pigment splatters that may occur, especially from a tipped pigment ring, as a nurse, I find them excessive, as you and your client should attend the appointment in clean clothing with no concern of cross-contamination from general illness. And in the hospital setting, gowns, hair, and shoe covers were really only reserved for the sickest patients, so that we did not spread germs to other rooms and other patients that we were caring for that day. Now, like I said, this is going to be a long chapter, so I want to make sure that you stay tuned for part 2 of chapter 5, and give this a subscribe, a like, and leave a comment, because I want to know your thoughts on cross-contamination and bloodborne pathogens in permanent makeup. And stay tuned for part 2 of sanitation and sterilization for the PMU Entrepreneur Bible.